Okay, hello everyone and welcome to this evening's broadcast. My name is Eric Goldman and I'm the editor of Holistic Primary Care here in lovely New York City. And I want to welcome you to this evening's show. This is a really interesting topic. I'm guessing many of you are somewhat familiar with nitric oxide. I mean, those of us of a certain age can remember back in 1998 when a trio of researchers won the Nobel Prize in Medicine and Physiology for discovering nitric oxide and all the many different things that it does. You know, in medicine, we tend not to like the word panacea. It's, we don't want to think that anything can actually cure all. But if there's anything that comes close to being a panacea, it's nitric oxide. I mean, it really does a lot of things physiologically. And it's good for improving the function of many different organ systems. And so tonight we're going to really delve into that. Our guest is Jay Wilkins, who's a natural medicine practitioner down in Georgia. And he's spent much of the last 20 years or so exploring nitric oxide, both in a clinical setting and in terms of keeping up on the research and synthesizing the many papers that have been coming out about it over the last number of years, and trying to make clinical sense of that. He's the founder of a company called Bionox, which has a very interesting formulation that's designed specifically to improve nitric oxide production in the body. And so Jay is going to give us like an in-depth tour of nitric oxide, how it works, why it works, what are the different pathways, and how you can utilize it in your practices to improve the health and well-being of your patients. So before we get into it and I turn things over to Jay, just a couple of practical matters. We are going to be taking questions at the end of Jay's presentation. If you want to ask a question, just go to the control panel on your screen there, and you'll see a little gray tab that says questions. And if you click that open, it'll open a dialog box and you could type the question and we will answer as many as we possibly can in a lot of time. There is a handout comprised of the slides that Jay will be presenting. That's in the little tab that says handouts. If you just open that and click on it, you'll see there's a PDF in there. And if you click on that, it will download to your computer so you don't have to go crazy taking notes unless you want to and you're obsessive compulsive like me, and you can do that. So that's it for the housekeeping. Before we turn things to Jay, just a couple of quick questions for you, just to get a sense of your engagement, your experience with nitric oxide. So here we go. Please answer this question. How familiar are you with the role of nitric oxide in cardiovascular health? I'll give you a minute to tally that. Okay, so about 76% of you are somewhat familiar with nitric oxide, and 14% say you're very familiar, but we hope you'll still learn something. And then 10% of you are new to the whole nitric oxide question. So our second question for you is, do you currently recommend supplements to your patients that support nitric oxide production? Okay, and that's looking like almost 45% are saying yes, 41% saying no, and about 13% are saying not sure. Okay, just a couple more. Okay, if you are recommending nitric oxide supporting products, are they arginine based, nitrate based, or are you not sure? Okay, and it looks like about half of you are using arginine-based products, 15% using nitrate-based, and 35% not sure. Okay, and just one more quickie. Do you currently recommend oral chelation supplements? Okay. It's looking like about a little over 80%, 83% are saying no, 17% saying yes. Great, well, thank you for that input. We do appreciate it. And with that, I'd like to turn things over to Jay Wilkins. So give me a sec to figure out how to do that. Okay, Jay, it's all yours.
Okay. Thank you so much. Do I need to do anything else, Eric? Were you good to go?
I think you've got to turn on your camera because I'm seeing your
Okay.
slides. But there
How's
you go.
that?
You go. Perfect.
Excellent. All right. Well, thank you so much, Eric, for the introduction. I appreciate also all the ones that are on this evening, and as well as participating in our poll. So get to know a little bit more about you. So yes, Bionox is the name of our company, and tonight's presentation, Nitric Oxide, your body's best medicine. So just a little bit about my background is that I've been in the health and wellness industry since 1993 and practiced in the field of naturopathic medicine from about 93 to 2005. And in 2005, in my practice, used homeopathy, used functional medicine, had massage therapists and various practitioners, and seeing a lot of people and doing great things, seeing great results. But in 2005 is when this information on the 1998 Nobel Prize winning research really came to the fore and came across my desk. So for a 7-year period there, I didn't know much about nitric oxide, even though I had a flourishing naturopathic practice. So this was very profound to me. It was amazing how much research was involved in this from 98 to the 2005 when I first learned about it. And so I got very excited about it. And then as well as some non-invasive equipment that also came along with that. That was a ability to take a snapshot of people's cardiovascular system using a non-invasive gadget, getting some data, and then be able to make recommendations on nitric oxide precursors, and then seeing the results after about 90 days. So it was really exciting to see this opportunity. So in 2005, I actually sold my practice and got involved in training other practitioners about pulse wave technology and educating about nitric oxide. Sat on a few different medical advisory boards for different nutritional companies that also was really ingrained in this nitric oxide world. So formulated a few products for some other companies in the nitric oxide space, and then got involved in manufacturing, and to this day still am a consultant to help other people to get their products up and running, and not just with nitric oxide, but various types of things that they're looking to create, help them put their formulas together. So in 2013 is when Bionox was formed. Bio, of course, life, Nox, a play on nitric oxide. So that's really the foundation of our nutraceutical company, is in the space of nitric oxide precursors. So to say I'm a nitric oxide enthusiast would be an understatement for sure. I hope by the end of the presentation, if you don't know much about nitric oxide, you'll be more enthusiastic. As our poll indicated, a lot of you are already involved in nitric oxide and recommending nitric oxide supplements to your patients, and hopefully you'll even be more enthusiastic by the end. So what is nitric oxide? Well, it's a very simple molecule. It's just 1 part nitrogen, 1 part oxygen, but so profound in what it does in your body. As mentioned by Eric earlier, you hate to use that word magic bullet, panacea, but certainly nitric oxide has so many implications when it comes to optimal health. It's made throughout your body. It's made through your cardiovascular system. It's made through your digestive system, as what we're going to really focus in on this evening. But it's made also, it's a neurotransmitter. It's made by your immune system and utilized. It's very ubiquitous. There's over 140,000 research articles on nitric oxide. Was a molecule of the year in 1992. Became the most researched molecule in history. And there's the three individuals that won the Nobel Prize, which many of you probably have seen those faces by now. And the first medication that came on board was the little blue pill. Of course, it was supposed to have been for blood pressure. It didn't really work that great as a blood pressure medication, but the men in the study noticed that it did have a effect for them, even though it didn't help them much with their blood pressure, and it led to this whole new class of drugs for ED, for erectile dysfunction. And so since then, a lot of pharmaceutical companies have been looking at this research, seeing what they can do to harness this molecule. But what's exciting to me is that this fits into the realms of natural medicine. And I saw this as a way to really get involved, get the medical community more involved, because the research was so sound. They just don't give Nobel prizes away for nothing. It's very well-founded research, and so it is something that both medical professionals as well as people that are working in my field in naturopathic medicine can utilize right away, benefit from. So this is good news. As you may have saw from the previous slide, when the Associated Press gave their announcement about this Nobel Prize winning research, they talked about the benefits for the cardiovascular system. Well, we know that statistically, the main issue that the people walking into our door as practitioners that they're going to be dealing with is cardiovascular issues. It is the #1 cause of death. 600,000 die each year due to heart disease. As women go through the menopausal years, it's 50-50 men to women. We know that 60% of the youth are at risk for heart disease, as 70% of 12-year-olds already have fatty streaks beginning to develop in their arteries. Every 60 seconds, someone dies of a heart attack. The effects of heart disease is like 7 Boeing 747s crashing with no survivors every day. So this hit me hard in that I realize now that when people come to see me, this is something that I need to know about. It's called the silent killer for a reason. They may not have many symptoms, but it's something that, especially if they're 40 and above, we really need to be looking at. Well, what does nitric oxide do? I mean, the question really is based on our screen here is, what doesn't it do? You look at, of course, for cardiovascular issues, high blood pressure, lipid issues, diabetes, anything to do with the cardiovascular, atherosclerosis. You look at issues also with the immune system, with urinogenital issues, prostatitis, cystitis, releasing ammonia that's in the system, helping fatty liver issues, again, immune dysfunction. There's so many things that nitric oxide really has implications for. So this is actually a little article that I can send you. It's a compilation of about 118 different studies that really support these statements here. So this, again, would be something I'd be more than happy to share with you. So many different things. Oh, and also athletics, big thing with regards to performance as well as recovery time for athletes. So I like what Dr. Stamler says. So we're going to get into now a lot of quotes from different colleagues of yours that are saying what nitric oxide can do. So Dr. Stamler, this is when he was at Duke University. He's moved on since then, but has done a lot of work in the field of nitric oxide. As he states, it does everything everywhere. You cannot name major cellular response or physiological effects in which nitric oxide is not implicated today. It's involved in complex behavioral changes in the airway relaxation, beating of the heart, dilation of blood vessels, regulation of intestinal movement, function of blood cells, the immune system, even the way fingers and arms move. So it is the molecule of life. In fact, at the time of conception, just before then, when the sperm meets the ovum, there's a lightning bolt of nitric oxide that is given out by the sperm, and that's how it gets there. So you're really here. We're here because of nitric oxide. So going back to that comment about the immune system, right now, if you'll go and look at COVID-19, search COVID-19 and nitric oxide, you will see that nitric oxide is the first line of offense, we might say. When someone goes in an emergency care situation, they administer nitric oxide gas. It helps for inflammation in the lungs. It helps to open up blood vessels in the lungs. It also helps for reducing and stopping the replication of viruses. So nitric oxide is very important. In China, they're actually doing a study right now that's using Viagra to treat individuals and seeing what the response is for nitric oxide, because again, that's what Viagra is involved with. So it's very relevant in today's world as getting the immune system up and running, get the shields up. And we'll touch on that even a little bit more as we go along. But these are a few books that were very impactful to me. The Cardiovascular Cure by Dr. John Cook, who's the head of cardiovascular research at Stanford, and he discusses what the cardiovascular cure is, and that turns out to be nitric oxide. This is Dr. Ignara, one of the Nobel Prize winners from 1998. No more heart disease, NO. So a little play on the word no there. And he talks about how nitric oxide can prevent and even reverse heart disease and strokes. The Arginine Solution by Drs. Fried and Merrill was very impactful. This was actually written really close to the time of the Nobel Prize winning research in 1998. So those first three books really having to do with arginine, citrulline precursors. And this last one here by Dr. Bryan, you may be familiar with his work, especially with the company Human N and Neo40, and very much into the nitrate pathway, which again, we'll discuss both of those. So that relatively new in comparison to these books on the arginine pathway. So how does your body make it? Well, there's a lot of ways. The internal jogging is good. That's laughter, right? That actually helps to produce nitric oxide. So a good belly laugh every day is very healthy, good medicine. Exercise creates nitric oxide. Dietary nitrates, actually infrared waves and beamer waves, you might be familiar with those. That creates nitric oxide in the body. A small amount of alcohol helps to create it, as well as the semi-essential amino acid arginine. And again, semi-essential because your body makes a certain amount of it and the rest you get from your diet. So what's the problem when it comes to nitric oxide? Well, the biggest challenge to nitric oxide is age. So when you're 20 years old, you have your optimal amount of nitric oxide levels. When you hit 40, you have about half of the nitric oxide you were making when you were 20. Now you add to that, like unfortunately with my family, genetics are very strong. My grandfather died very early in his 60s due to a massive heart attack. And that's true of so many families. Genetics play a big role. Ethnicity, diet, medications, stress, which causes oxidation, as well as smoking, to name but a few. Diabetes is terrible as far as reducing the nitric oxide levels in the body. So we're going to go to the right there. We see the early stages of cardiovascular issues. It begins with fatty streaks, and then it kind of escalates. So then your body sends in white blood cells and it creates these foam cells, and progressively you can add calcification to that. So in that mess, if you look on down the line there, going from left to right, you see that vulnerable plaque that really is dangerous. This is the number one reason why people have heart attacks and strokes, is not because of this hard calcified plaque, but this vulnerable plaque, which again is made up of white blood cells, oxidized cholesterol, calcium, heavy metals, infection. All those things are brewing in this pus-like environment, to where the endothelium, that top layer, gets very thin, and it's the only layer that's really protecting from a rupture. But what can happen is a whistle-like effect can occur, and it knocks the top of that endothelium off, and all that nastiness spews into the blood vessel. The body compensates by making a thrombus or a clot. So you get a clotting in the neck, and where you already have narrowing, that can lead to a stroke. Whereas if you have it in the heart, of course, it leads to a heart attack. So that is a very dangerous situation. All the infection and inflammation and toxicity in those vulnerable plaques. Now, this is what Dr. John Cook brought out about in his book, The Cardiovascular Cure. And I like this quote from Paul Van Hoot as well. You're only as old as your endothelium. So true. So the endothelium, just again, one cell layer thick. It's that lining that lines your arteries. It is what is between the muscularis and your blood that's flowing through there in your artery. So the word picture that Dr. Cook uses is that a healthy endothelium is like Teflon, where nothing sticks to it. It's a non-stick surface, everything flows. Whereas your endothelium, when it becomes dysfunctional, it becomes like Velcro. And that's where white blood cells and platelets stick to it. So prior to erectile dysfunction, that ED, you actually have a much worse situation. You have the ED of endothelial dysfunction. So that's the goal. And the good news is, as your body starts to regenerate its nitric oxide, then that plaquing, all that toxicity, all that damage that was done can be reversed. And we're definitely seeing it. So very cool thing. So we'll start with the arginine nitric oxide pathway. As we see here, arginine converts into nitric oxide by nitric oxide synthase that's created in the endothelium. And citrulline also is in that pathway. So citrulline converts into arginine and then into nitric oxide. So they are created a little bit differently, but through this same pathway. And the primary thing that we see there is vasodilation. So very cool thing. That was one of the things that I was amazed with when I first started using nitric oxide precursors, arginine and citrulline, that individuals with blood pressure, I never saw anything that worked as effectively as the right dosage and combinations of arginine and citrulline, because again, number one thing it helps to do is to relax the blood vessel. Dr. Ignarro, another one of the nitric oxide superheroes for sure. Again, he's one of the 3 Nobel Prize winners. And this is what he says: L-arginine is a naturally produced protein building block called an amino acid. L-arginine enhances blood flow and improves the activity of the endothelial cells because it is converted to NO in the body. Although L-arginine is found in some foods, red meat, fish, chicken, beans, soy, nuts, you cannot normally consume sufficient amounts in your diet from meals alone. So I will be recommending that you take L-arginine supplements each day. So that's the fact. As we have more stress, our nutritional needs are changing. We need more nutrition, and arginine is definitely, as Dr. Ignarro brings out, is one of those things that we need to be supplementing. This is a great slide. You know, picture's worth 1,000 words, and it really shows the effectiveness of specific nutrients on plaque regression. This is a study that was done both by Dr. Cook and by Dr. Ignarro in separate studies, and it was rabbits that were given a high cholesterol diet. They all developed plaquing in their aorta, and when they went back to a regular rabbit diet, the plaquing didn't go away. But when they gave specific nutrients, they were able to observe regression. So as we see, each group is they're something different. So group 1 is just the regular rabbit diet. That's for the plaquing that they had there. Group 2 is just with L-arginine. Group 3 just with citrulline. Group 4 L-arginine and citrulline together. Group 5 vitamin C and E. Group 6 is arginine and vitamin C and E, and then group 7 has all 4 of those nutrients. And so what you see is progressively which of these things get the best results when you use them synergistically in combination. And you can see by far and away that group 7, arginine, citrulline with the antioxidants, vitamin C and E, got the best results. And the reason is because antioxidants help to sustain nitric oxide. It's a very short-lived molecule. but through supplementing with antioxidants, you can sustain those nitric oxide levels much better and get the best outcome for regression of plaquing. Doctors Fried and Merrill, let's see, let me go back here. They brought out in the arginine solution. In the field of medicine and health, it is one of the revolutions of our time, the discovery that the amino acid arginine may be the magic bullet for the cardiovascular system. So they outline all the different issues with a lack of nitric oxide. And again, you name the cardiovascular issue, and nitric oxide has implications in helping to restore good health. And so they're the ones that call it the magic bullet. I couldn't really agree more. Dr. Whitaker, a lot of people know this gentleman. He was really a forerunner of this movement of integrative medicine and functional medicine, and was an early adopter of nutrition and out in California. And his comment here is inadequate production of NO increases arterial damage. There is a way, however, to break this vicious cycle. Arginine supplements have been shown to restore normal function in damaged arteries. So people do not have to be stuck with their plaque. There's things that can be done. Dr. Sherry Rogers wrote The High Blood Pressure Hoax, and a very revealing publication. Researchers have shown that not only does nitric oxide slow plaque growth and suppress arteriosclerosis from forming, but arginine has actually melted away plaque that already existed on artery walls. Dr. Sinatra, probably familiar with him, integrative cardiologist, and this is what he says about L-arginine and nitric oxide. He says L-arginine has value for the whole gamut of atherosclerosis, from early signs such as high blood pressure and erectile dysfunction to advanced cardiac events. We feel it offers promise for plaque stabilization and reversal. So that's an important thing there. You notice it said stabilization. So when you're trying to stabilize those vulnerable plaques, he's bringing out arginine is a great way to be able to protect those blood vessels from rupturing. But then he says, and reversal. Goes on to say it is inexpensive and non-toxic. We use it clinically for treating angina, high blood pressure, erectile dysfunction, and stubborn risk factors we can't otherwise improve. So I like that last sentence because, again, when he's challenged with a particular cardiovascular issue, he finds that precursors of L-arginine producing nitric oxide, you can affect stubborn risk factors that cannot otherwise be improved. And this is probably my favorite gentleman because I guess because I know him personally, got a chance to speak with him. We were on the same medical advisory board for a nutritional company at one time, and such an important guy. He's a diabetic specialist, endocrinologist out in the Bay Area. And his work is so important because, as the statistic shows there, 75% of diabetics die of a heart attack and stroke. So a little bit about his story. He was a speaker, a lecturer for statin medications, and he would go with another man by the name of Victor Zhao, who was a cardiologist. He was the head of cardiovascular research at Stanford prior to John Cook. He went on to Harvard, actually, and they would go and they would lecture about statins and how they would work. Dr. Zhao would talk about his cardiovascular patients and how the effects he saw, and Dr. Prendergast would talk about his diabetic patients and the effects that he saw. Well, Dr. Zhao said something to Dr. Prendergast. He said, I got some research coming that you're going to love. And Dr. Prendergast was, well, tell me about it. I'm interested. He said, well, I can't. It's my research. So he went online and found out what he was doing, and it had all to do about arginine. Well, this is important to Dr. Prendergast because his father died at a young age. He was crippled from a stroke, several strokes, and so he saw what cardiovascular disease did to his own father. He knew himself he was in trouble because as a 30-year-old, he went to a friend of his that did a abdominal scan and saw that there was some aneurysm, some blockage that was beginning to develop. And he was looking at his x-rays and said, "Who's your cardiologist?" So he knew he was in trouble as a 30-year-old. And so just from Dr. Zhao's research, he went and he started taking arginine. And so he had his friend that took his x-ray in his 30s of his abdominal aorta and had him take another scan in his 60s. This time when he was looking at his x-rays there, he said, "What are you doing?" And I want to do it, because he could see with his own eyes the regression of plaquing that had taken place. So Dr. Prendergast started giving it to his diabetic patients. Prior to nitric oxide based nutrition, he would send about 250 patients a year to a cardiologist. After introducing them to arginine, maybe one per year, to the point where there was 3 doctors that he was referring to. They all took him out to lunch at the same time, and they said, "Look, what did we do? Did we make you mad? You're not sending us patients anymore." And he started to tell them all about the arginine story and what it was doing for his patients. And of course, they really didn't have an interest in that. They were paid to do surgeries and those type of things. And so it didn't make really any impact for them. But for Dr. Prendergast and his patients, while he's not in practice anymore, but during that time period, he did not have one diabetic patient to have a heart attack or stroke for a period of over 20 plus years. So again, the superhero. Has more clinical experience, I think, than anyone, especially with regards to how arginine works with the diabetic population. So really good guy, excellent to listen to him speak. Miss him a lot. Now, so we talked about the arginine and citrulline pathway. Let's talk about the nitrate, nitrite, nitric oxide pathway. So this altogether works in a different way. As we saw earlier, the arginine works within the cardiovascular system with the endothelium and the enzyme that's produced there. But nitrate and nitrite works in the nitric oxide system by means of your digestive tract. So you consume nitrites and nitrates. As a matter of fact, arugula, as shown there, is higher in nitrate by weight than anything else. We hear a lot about beets, and they are higher in nitrates as well, but arugula is one of those that's actually higher by weight than beets are in the amount of nitrate that's in there. And so a great thing you can do if you like arugula and a beet salad with some goat cheese, excellent way to get a real nitric oxide boost, and it's delicious. So this is how it works. You consume the nitrate rich foods, your saliva, if you have a good microbiome in your mouth, good oral bacteria. So the first thing is that we'll say is don't use antiseptic mouthwash, because you're killing your good microflora in your mouth. You need that to be able to convert those nitrates that you're consuming into nitrites. And then as the nitrites funnel on down the pathway into your stomach, then that's where through your stomach acid, you convert those nitrites into nitric oxide. So what would be another medication that you'd want to avoid if you're trying to boost your nitric oxide? And that is antacids and protein pump inhibitors. Those things will inhibit greatly your ability to create nitric oxide through your digestive tract with nitrates. So you then start to absorb that good nitric oxide that's being produced throughout your digestive system. The kidney excretes some as nitrate, but a lot of that gets recirculated, recycled, and it ends up back into your salivary glands, so that when you make saliva, you're actually producing the good nitrates and converting them again, so you can recycle that. So it's a very important way, as some people, they may have a challenge to convert arginine and citrulline into nitric oxide. And so doing it through your digestive tract could be a good way to start that process of getting your nitric oxide levels up. And that in turn will help that endothelium to be more useful in creating nitric oxide through the arginine pathway. So it's a very important way to create nitric oxide. So a few different resources for that. Many of you have heard of the DASH diet, dietary approaches to stop hypertension. That diet could lead you to be taking in 12 to 1800 milligrams of nitrates daily. So that's been a big field of research, is just how much nitrates should you be consuming. We talked about Nathan Bryan earlier in his book about functional medicine. He states that we should be getting at least 400 milligrams per serving of nitrates. And then we have the DASH diet, which the threshold is much higher. Dr. Greger, if you're not haven't already, subscribe to his YouTube channel. Very short videos, very informative, funny, but very much an advocate for nitrates and the nitrate, nitrite, nitric oxide pathway. So what would make a best nitric oxide boosting supplement, in my humble opinion? Well, one is you have to have the right ratios of arginine and citrulline. So you have to have the right amounts, and daily 5 grams would be a minimum, 2,000 of citrulline minimum, more if the condition is more severe. But the ratios are important to really create a 24-hour release of nitric oxide. So if you're to take that 7 grams or so of that mix 2-to-1 amino acid ratio, and you take 3,500 milligrams in the morning to another 3,500 milligrams of that ratio later on, about 12 hours, you make a nice 24-hour release. And this is according to Dr. Rainier Boger's work, really helping to see what the right ratios should be to get that type of release. Nitrates, as mentioned, are a good thing to add to your regimen to boost your nitric oxide levels, so you're really stoking both pathways. But just as we saw from our slide with the study that Dr. Cook and Dr. Ignaro did with the plaque regression, we see how important antioxidants are. So vitamin C, vitamin E, there's certain fruits like pomegranate, camu berry, grape seed, grape skin extract, that helps to sustain nitric oxide levels much better, because the nitric oxide is very susceptible to free radical damage. So you want to have those antioxidants. We also recommend high, well, it's not really that high anymore, but at least 5,000 IUs of vitamin D. That's been shown to have not only the antioxidant benefits, but to help to get calcium out of places it shouldn't be, like in your arteries, and metabolized in places that it should be. So vitamin D is very important for that calcium metabolism process. Vitamin K as well, which we'll talk about in a minute. But pH balancing is important. So nitric oxide is also created in a more alkaline type of environment. And then things that can support the endothelial dysfunction. When it gets to be that way, you want to have certain herbs like hawthorn berry, green coffee, horse chestnut, Indian gooseberry. So hawthorn berry seems to work more for cardiovascular upper regions of the body, heart, brachial arteries, things like that. The horse chestnut seems to work more lower extremity. And so having a combination of those herbs along with Indian gooseberry or amla is very supportive for the cardiovascular system. And then you want to make sure that if you're taking these things, you absorb them. So there's a proprietary blend of astragalus and ginseng that's called Astrogen that has been proven to increase absorption of amino acids like arginine and citrulline by over 60% as compared to without it. So, and it actually increases the boost of the absorption of all vitamins and minerals, but particularly amino acid. It's quite important. So this brings us to our product line. I know this is a little bit of a shameless proclamation of our product line, but we'll go through it a bit. So our original product is the M3 berry. These are all naturally flavored. They're all naturally sweetened, and that's not easy. If you ever have tried straight arginine, it's been described as tasting something like old gym socks mixed with old fish. So if you can imagine that combination, not too pleasing. But so we wanted to make sure though that, again, it's safe for people with blood sugar issues, and so we use all natural sweeteners, and it's sugar-free. So we have the original berry flavor, which is the one over to the left there. It has all those different nutrients in it that we just saw on the previous slide, with the right amounts of the arginine and the citrulline, the antioxidants, and the estrogen, vitamin D. And then we wanted to introduce vitamin K. We had a lot of practitioners and individuals saying that, based on the research, that it would be important to add vitamin K. And then I looked at the research for a long time before we adopted it. So we created the citrus flavor, and this has added vitamin K2, 180 micrograms of vitamin K2 per serving. And the way this is set up, you take 1 scoop again in the morning, then you do another scoop 12 hours later to give that nice 24-hour release of nitric oxide. And then for the nitrate pathway, now we have beets in the M3 product, and it kind of opens the door, it kind of opens the door to the nitrate pathway. But the NOx3 greens and those green leafy vegetables, and which are high in nitrates, so spinach, arugula, all the various grasses, wheatgrass and so on, they're high in nitrates. And so the NOx3 greens is a way to really implement more nitrates into your diet. And we're going to be working on more formulas that really stoke the nitrite pathway. And then, as we mentioned, within arteries, heavy metals really assault the inside of the arteries, so we're a big believer in oral chelation. So the Chelanox is a very up-to-date chelation formula, and it has EDTA, as well as the modified citrus pectin, cilantro, shilajit, zeolites, as well as the support for the liver and the kidneys. So as you're eliminating these various metals and things, it also helps for calcium that's in places that it shouldn't be. And it helps then as you get the liver and the kidneys involved in helping to excrete those toxins. So that's just a few of our really top shelf products, particularly with the nitric oxide story that we're very happy with. We get so many different reviews. We have over 500 positive reviews at this point of people that have seen benefits using our supplements. So now, how do we know if somebody needs it? And we'll touch briefly on this pulse wave technology. When I first got involved in this in 2005, we had a medical device, class 2 medical device, and it uses plethysmography technology to be able to clips to the fingertip, and you get information. We'll go through that, but so I'd actually worked with a medical doctor here in the Atlanta area. He had a big base of diabetics and cardiovascular patients, and we did a ton of these tests just to see where they were at, and the insurance companies reimburse for it. So it's a recognized mode of being able to get information about the cardiovascular system. So again, those were $6,000–7,000. Now we have for $500, we're getting the same data and being able to do a heart rate variability along with a plethysmography test. A simultaneous test takes 3 minutes. So here's just some of the data. So heart rate variability, many of you may be familiar with that. Test the autonomic nervous system, parasympathetic to sympathetic nervous system. It shows if you're more emotional stress as compared to physical stress. But then on the right side, you see the arterial health analysis. So it shows large artery circulation, shows peripheral circulation, and based on the pulse wave that's created, and there's 7 different pulse waves that it detects, you either have good absorption of the light that's being shined down through the nail bed, and it's indicating good blood flow, to where type 7 is the worst case scenario, and you can see where they're at in between there. Why I love this device is that not only were people feeling better as their circulation improved, their blood pressure numbers improving, their lipid numbers improving, a lot of things improving, but we had a way to actually verify in a very objective way that the nutrients were doing something. So I really noted it for several years, really, and 90% of the people that were taking the protocol as recommended to boost nitric oxide, 90% of them were testing better after a period of about 90 days. So it's a cool way to, first of all, see where people are at, even though they may not have any symptoms of cardiovascular issues, and then being able to show them, which increases compliance, where they were and where they've come to after they've taken the nutrition. So a really nice piece of equipment that I feel every office should have to be able to show where people are at and monitor how they're doing. So, but as mentioned, the test is not necessary. As we know, if you're 40 and over, nitric oxide levels are starting to come down significantly. If you're dealing with any sort of cardiovascular issue, you no doubt there is a nitric oxide issue. Any sort of lipid disorders. We've seen where people's cholesterol would not budge even with medications or diet and exercise. By increasing nitric oxide, we've seen some really nice reductions in numbers. Blood sugar, well, nitric oxide helps the tissue to become more sensitive to insulin, as well as arginine is a precursor to insulin. So we've seen great results with blood sugar, and then of course we know the complication of diabetes as well to the cardiovascular system. Immune system issues, this is a great way to keep your shields up, your T cells, B cells, macrophage, all of them. They utilize nitric oxide to disable pathogens. So anything to do with the immune system, nitric oxide is a great modulator of that. Eye issues, Bausch & Lomb actually has drops that help to produce nitric oxide for glaucoma people. And same thing, we've seen fantastic results in people's vision, glaucoma outcomes, you name the eye issue. By increasing circulation, you can see benefits. Number one thing that people notice when they start to take arginine and nitric oxide precursors, energy improves, getting better oxygenation, better endurance, better stamina. And also, arginine is a precursor to HGH, so their sleep patterns are much more restorative and they sleep better. We see people that are interested in reducing their medication, and nitric oxide precursors have helped with that. Sexual dysfunction, well, we discussed that already. That's really a problem with the cardiovascular system and nitric oxide. The brain, it needs oxygenation. If oxygen is not getting there due to blockage and those type of problems in the arteries, well, the brain will respond in a positive way as you get more oxygen. As mentioned, nitric oxide is also a neurotransmitter. So precursors to serotonin, dopamine, acetylcholine, those type of things. So you get a much happier brain when you have nitric oxide. Athletic performance, by increasing NO before a workout and during a workout and post-workout, you increase endurance, stamina, the ability to have more reps, to not hit a wall, and also for the recovery time being much less. The interesting thing too is inflammation, and even inflammation, of course, we talk about inflammation that you don't know about, that could be in your arteries, but a lot of times people, they notice they have inflammation in their joints and muscles and such. And so a lot of the people that I was seeing when I first got involved with this, that I was making these recommendations to help their cardiovascular system, they would come back and they say, you know, I don't need my pain meds anymore. Could this be what's happening? Is what we're doing here? And so I looked at the research, and sure enough, there's a lot of great research on nitric oxide and inflammation. So a test is not necessary, but a test is a great way to really show people where they're at and where they can go. What are people saying? Well, as mentioned, we have over 500 positive reviews by doctors and helping with blood pressure issues there, like Dr. Rasmussen, and then issues with blood sugar and AFib, issues with energy and with working out, And this Mike here talks about he had bypass operation and he went back later and the doctor said he was doing great after using M3. Again, there's a varied amounts of that. And we're not gonna make any claims, but people are seeing fantastic results. So it's so encouraging to see, for me, to see and get these phone calls of the impact that our products are having in their life. And so that's our tagline, Bionox Motivating Wellness. That's what we do. We're trying to shift people's lives from where they're currently at and utilizing nutrients like the M3, the NOx3 greens, the Kelonox, and help them to get to a higher state of life. So that's our goal, is to help to motivate people's wellness in a positive direction.
Great, thank you, Jay. That was terrific. Really, really good comprehensive review of the state of nitric oxide research, and also a lot of really practical things. I see we do have a number of questions coming in from the audience. Before we take those, though, I just want to let you all know that Bionox is going to be offering a special deal, special pricing on the products that you just heard about. For anybody who attended this webinar. You'll get an email about that sometime in the next couple of days, right, Jay?
That's right.
Yeah,
Yeah,
so watch your inbox for that. I think it's 25% discount.
It is, yeah. We're doing a really special deal for the audience here. Of course, we always offer professional pricing, but we want to do a 25% off that. Even the little smart pulse devices, as mentioned, those are $500. We're going to do 25% off of that. We want doctors, practitioners to experience the benefits of this with their clients and patients, and so we want to make it easy for them.
Great. Okay, ready to take some questions?
Yeah.
Great. Okay, GE has a couple of questions. One is arginine is used in the urea cycle to clear out ammonia. Can nitrate help the urea cycle?
And say the last part again, I'm sorry.
Can nitrate, or I guess nitrate support, help the urea cycle?
Right. So that it does help with clearing out ammonia, and that was shown in both the research on the arginine and the nitrate pathway for ammonia clearing. So individuals that are having kidney issues, ammonia issues, both those have been shown to help for ammonia clearing.
Great. And the same questioner is also asking, what lab tests are you using to assess nitric oxide, or is it strictly based on the pulse wave?
Yeah, primarily pulse wave and just lipid tests. I know there's a good ADMA test that can be used along with arginine products. And so I forget which lab does the ADMA test. I've not used that. And I know there's other cardiovascular panel tests that are out there that could be useful, but primarily just regular lipid tests, the pulse wave, blood pressure tests, those type of things is the tools that I've been using.
So it's really more an assessment of the epithelial and endothelial function,
right,
rather than the nitric oxide levels in the blood or something like that.
Right. So then there's a lot of devices. Of course, the EndoPat is one that detects endothelial dysfunction, and doctors are using, and you can use these same arginine, citrulline type supplements and see results with a flow mediated dilation. People are using ultrasound tests that check for carotid artery, and those type of tests also have been used. And I don't personally use those, but my base of clients that have gone to other practitioners, they are seeing changes in those tests as well, carotid artery tests and such.
Great, thanks. Okay, I was asking about the oral microbiome influence on NO, and I thought that was interesting. You kind of touched on that. Can you say a little more? Are there particular organisms that are either beneficial for NO production or detrimental to it?
Yeah, so that is interesting. In fact, I thought from Dr. Bryan's work, I thought this was interesting that breast milk is very high in nitrites, and which makes sense because babies don't have the microbiome to be able to convert nitrates into nitrites, and so breast milk is high in nitrites. And at some point, when the baby develops their microbiome, the breast milk actually becomes more nitrate rich, and when they hit that point. So oral bacteria is very critical for that reduction of nitrates to nitrites. So again, your pH is critical in your mouth for proper microflora, the proper bacteria, and there's who knows how many that should be in our mouth as well as our gut. But so it's very critical. If consuming nitrates is great, but if we don't have the ability to convert them to nitrites, then we're not going to be able to create nitric oxide.
And since you've touched on it, what about the gut microbiome? Are there organisms down there that we should be paying attention to?
Well, yeah, for all throughout your digestive tract, you're still absorbing some nitric oxide. So primarily with stomach and small intestine is where the majority of your nitric oxide is created and absorbed, but all throughout your gut. So yeah, you'd want to have a healthy microbiome in the large intestine as well for optimal nitric oxide benefits.
Just bringing up the question, do patients with SIBO, do they show compromised nitric oxide?
I would expect so. Yeah, because all that is important. I mean, it's going to be damaging to your ability for absorption. So I would assume that would be the case. Primarily, your mouth in the digestive tract and stomach is going to be the most critical for the nitrite to nitrate, excuse me, the nitrate to nitrite to nitric oxide. But I would have to believe that SIBO and dysfunction in the small intestine would create issues also.
Beth would like to know if someone with oxalate issues can take the nitrate product, the greens product that has a lot of oxalate-rich vegetables in there. What's your thought on that?
Right. Yeah. So a lot of that particular product does have oxalates in it. Some of these products are out there. They have reduced or eliminated oxalates out of their various products. We're going to be looking at that and working on developing supplements like that as well. So, but right now, currently, our NOx3 product, does have spinach. It has the greens in it, so, and it's not oxalate free.
Okay. Okay, Irina would like to know, what is the name of the eye drop product that you mentioned for glaucoma?
Oh, Bausch and Lomb is the one that produced. I can't remember the name of the actual medication, but if you'll do a little Google on Bausch and Lomb and glaucoma, nitric oxide, I'm sure it'll come up.
Okay, Deirdre's asking about patients that have pacemakers. Any improvement in patients? Is it safe with patients with pacemakers?
It's safe. Yeah, there's no contraindications. There's, of course, that's something that their doctor would want to be involved with, no doubt, but and ask them. But there are really no known contraindications of nitric oxide precursors. The only thing that people would want to do, obviously, if they're on a blood pressure medication, they'd want to monitor their blood pressure, because as their blood pressure normalizes, taking medication on top of that could make it too low. Also, if they're on any sort of blood thinners, because nitric oxide is also an anti-aggregate and helps to prevent clumping and clotting and those type of things. It's not a blood thinner per se, but it could make an effect. As people, I would say, as people get healthier, their needs for their medications can change. So they just want to monitor those things. But as far as like a pacemaker or those type of things, I have not seen anything that would indicate that there's any contraindication with that.
Are there improvements? Do you know if there's any studies looking at that? People
As far as improvements, I know there is as far as cardiac output, really nice studies on that. And there are also with electrical irregularities with the heart. As far as a pacemaker, I'm not sure if they have a pacemaker that would make some improvements that way. I would assume anything related to cardiovascular there'd be improvements, but you just never know.
Right. Okay. Beth is asking about how does the arginine product affect atrial fibrillation?
So as people get more oxygenation in their heart, there is a fact that, again, it's one of those things that you don't know what improvements you're going to see with individuals. So certainly electrical system issues with the heart can be varied, and it's not to say that everybody's going to have the same results with their AFib as they boost their nitric oxide. But as people have increased their oxygenation, increased their mitochondrial function, which of course these amino acids also help with, we've just seen where people have had really great results by increasing blood flow and increasing their nitric oxide levels. So, but it could be that they definitely could use something in addition to that for that particular issue.
Okay. And Ruxana is asking, would you repeat the name of the company that makes the eye drops? So that's Bausch & Lomb, you said, right?
Bausch & Lomb, yes. My wife found it. And it is VYZULTA. Vyzulta, I guess is how you would.
There is a panel of well-paid experts who spent a week figuring out that name, you know.
Of course. It makes so much sense, right? I don't know.
Irina's writing in saying that the AMDA test that you mentioned, that's CHL, I assume that means Cleveland Heart Labs.
Okay, good.
Everybody knows that. Okay, Deirdre is asking about the blood thinner question. Is it safe to use these products with blood thinners, you know, patients who are on blood thinners?
Right. Yeah, so again, anytime they're taking a blood thinner, we just recommend that whatever they're doing to monitor it, that pro time or whatever they're doing, that they continue to have it monitored, and just then they can, with their help with their doctor, see what they want to do. Of course, our goal in naturopathic medicine was always try to get to the cause of the issue and help people. Most people are interested in medication reduction. Of course, again, they'd have to talk that over with their practitioner, but it would be my goal if I had issues with blood viscosity, that I would want to do what I could to be able to reduce those. So if I'm getting healthier and maybe my blood's getting a little more thin, well, what can be done then medication wise to change that as I get healthier? But so again, it's just something that they want to have monitored, keep an eye on, and then make the adjustment in the medication ideally.
I'm wondering, when working with patients, are these products something that people use in a kind of a quote quasi-therapeutic way for a set period of time, and then their natural NO production kind of goes up and it normalizes? Or is this the kind of thing where one would stay on it for life, so to speak?
Yeah, that's a good question, and it's one obviously that the patients want to know. They're like, how long do I need to take this? So there's no data showing that it's not safe to do daily. We consume arginine in our diet naturally. We consume nitrates in our diet naturally. And so I just tell people that, look, heart disease runs strong in my family, and if I can avoid having a heart attack or a stroke, I'm going to do it. And so this has been a daily routine for me since 2005. So that's sort of my stance is I want to continue to put things in my body that's going to help me to, keep me at optimal health. So, we saw the statistics, what happens at age 40. And so in my estimation, we need to be doing things daily to boost nitric oxide.
So this kind of supplementation protocol isn't going to reverse, so to speak, that general aging trend where your natural nitric oxide production goes down.
Yeah, no, it's going to get it's going to get the endothelium much healthier, it's going to get the arteries much more flexible and youthful, but you're still always going to need to do things to stoke the nitric oxide fires through those pathways.
So it's kind of like working out or doing yoga or something. You have to keep at it. It doesn't.
Good analogy. Yeah, perfect.
Okay, Lawrence wants to know what natural foods or fruits can improve NO levels in the body. You talked about arugula and beets. What else would you encourage people to put in their diets?
Spinach, all green leafy foods really are high in nitrate levels, and so and then of course your antioxidant fruits. So all the fruits and vegetables high in antioxidants, your berries and things help to sustain the nitric oxide levels. They help to reduce general inflammation. So those the grape seed, grape skin benefits, resveratrol. Curcumin has been shown also to benefit flow mediated dilation, and so has a benefit with nitric oxide as well. Amla, as mentioned, Indian gooseberry. So there are a lot of botanicals and natural fruits that do help in that pathway.
Excellent. Okay, Jose is asking, are there any direct effects of NO on insulin resistance? You sort of touched on that or hinted at it. Can you say more about that?
Yes, so again, NO does help for insulin, so it does have an effect, a beneficial effect on the cell wall to help with insulin sensitivity. So that's a key thing, as well as we mentioned, arginine is a precursor to insulin itself. So those are, and there's other nutrients that are very helpful for insulin sensitivity. We actually have a product that has a lot of different antioxidants and botanicals in it for really supporting even more the insulin sensitivity issue. There are fatty acids that are very important for insulin sensitivity. So it does help for insulin sensitivity, and maybe even more so for the issues that are created from diabetes with nitric oxide in the cardiovascular system. So the arginine, the nitric oxide product would be a good adjunct nutritionally to other nutritional programs for insulin sensitivity.
But it's not like a standalone, so to speak, therapy.
Right. Correct.
Okay. Any contraindications to the use of L-arginine immediately post-MI, post-myocardial infarction?
There was a study that was done a while ago that got a lot of press that had showed negative outcomes for cardiovascular issues post a heart attack. And the study wasn't, and actually Dr. Prendergast, I mentioned earlier, he kind of did, several doctors really debunked that study, because there were 6 individuals that died in the study, but I think 3 of them were from sepsis, and the other ones that might have been cardiovascular related. But one of the things that, which brings up another point, we use arginine AKG, alpha ketoglutarate, in our product, which seems to be much more absorbable. It seems to also be one that has less stress digestively. Arginine does create, digestive upset at high doses for some people. We get a lot less of that. But in that study, they used arginine HCl, which creates issues with potassium levels. So it was thought that it could have been even the form of arginine that was used could have created some of the outcomes. So, but to answer your question, again, what nitric oxide does, it helps to stabilize the blood vessels from rupturing. They also help for restenosis of the stents that are used and of arterial blockages. So to say to use it right after, if they're on a lot of medications, they may want to wait after their doctor reduces some of their pharmaceuticals. But I would really think it would be a good idea that at some point that they look at some natural interventions to help them for hopefully not having one of those events again.
Are you finding that cardiologists are open to these kind of things now?
Yeah, I mean, we're seeing a big shift. I mean, you've been in the business a long time as well. We're seeing a big shift in the general medical in how they're perceived. In fact, I just have to share this little story. Again, we don't make any claims, but it kind of goes in with your last question as well. A friend of ours, she'd been using our products for years. She's in her 70s, and her husband was not using it. And so she feels great on it. She loves the product, wouldn't be without it. Well, so he went into the hospital and because he had a heart attack. And it was very severe. Didn't know that he was going to pull out of it. But anyway, he took our product to his cardiologist, and this is what they said. He said he looked at the canister, looked at the ingredients, said, if you'd been taking this, you would have had to come in here and see me.
Wow. Wow.
So, yeah, so that's the kind of thing that we're seeing. They're not even integrative, medical doctors. These are just regular cardiologists and medical doctors. And we're getting a lot of response like that.
That's great to hear. Because when I think one of the issues that happens with patients or regular people is when they're getting one piece of advice from somebody, say a naturopath or a functional medicine doc, to take this, try this, I think it'll be good for you. And then they go to their conventional doc and the doc says, absolutely no way, supplements are all garbage, expensive urine, whatever, we've heard all the arguments. And then the patient is sort of stuck going, okay, which direction do I want to go with? So it's really nice that a lot of the more mainstream trained cardiologists are getting on board with this.
Right. I agree. And that was so exciting when I first saw this in 1998. I thought, this is something, how can the medical profession refute this? And it all pointed again to arginine at the time. That's what this, this discovery in 1998 that led to that. It was based on the arginine pathway. So it's like, how can they refute this? And I think, they are seeing it. They're learning about it now in med school, and they're understanding it better.
As long as we're on arginine for a second, some people hold that taking arginine supplementing with it will trigger herpes outbreaks. Is there any truth to that? Or is it just an urban legend kind of thing?
No, it's legit. So arginine does activate the herpes virus. It feeds off that. So what we're seeing though is that a couple things. One is that some of them, they may have an outbreak, but if they continue, a lot of them sort of get through it and then they don't have the outbreak. So their immune system seems to improve. And of course, there's a lot of vitamin D in our product as well. So that helps with immune system modulation. And so, and then the type of arginine that we're using could be a component to where we're not seeing it as much as well. But the other thing is that people can do is they can do the arginine at one part of the day and then do like 1,000 milligrams of lysine at another time of the day, and it kind of counteracts the issues with that.
So you're
So
saying
there's a
1,000
few
milligrams
different
of lysine?
strategies. I'm sorry.
1,000 milligrams of lysine?
Right. Yeah.
But don't take them together.
No, because they counteract one another. So you want to get the full benefits of the arginine when you take it, and then the lysine can be taken later on.
Good to know. It's a nice little practice pearl there. Okay. Let's see. Yaroslav would like to know, what about using ornithine or citrulline? Are you using ornithine? Do you recommend it?
No, and I know that works as well. Most of the research that I've done, the Nobel Prize winners, it was all about arginine and then citrulline, and then some of these other amino acids seem to come along. So I have not now, with my understanding about amino acids, they can be competitive. In fact, with the M3 product, our arginine product, you don't want to take with a protein meal because of the amino acids. So you can start to have too many in your complex to where you may be reducing the effectiveness of one of them. So arginine and citrulline seem to play really well together. And, citrulline helps to turbocharge and to help the recycling of the arginine. So it creates more of a sustained nitric oxide release. Ornithine could be great as well, but then to introduce another amino acid into the complex, it could be creating some challenges with the effectiveness, the power of the other ones. So that's my only comment about that.
What's your ideal time interval between, say, like a high protein meal and taking the supplement, or vice versa, the supplement, and then when can you safely take the high protein meal?
Yeah, ideally they would wait at least an hour. We tell people, whatever, 20 minutes minimum, but at least an hour. So if they take it behind that, the protein will have gone through and done its thing, and then comes the arginine and the citrulline. So wait at least 20 minutes, ideally an hour.
Okay, great. Okay, Anne is asking, is there a problem with excess arginine creating a lysine deficiency?
I have not heard of any issues like that. I know that that's what some claim, that taking isolated amino acids, you create an imbalance with other amino acids. But I think a doctor friend that I had, a colleague, as he mentioned, he said we're all getting complex amino acids in our diet. So if we're taking these isolated amino acids, we're still going to get, through our protein sources, we're going to get the complex of amino acids. So we're going to get the lysine, we're going to get the other amino acids in our diet. So there shouldn't be any issue where it creates an imbalance.
Oh, this is a fun question. Do the supplements have an effect on the glycocalyx?
That I'm not sure. That's a good question. That's one I'll have to make note of and get back.
Yeah, because that's starting to gain a lot of attention in the functional medicine world, this whole glycocalyx phenomenon.
Okay.
Okay. Along the same lines as the herpes question, Roxana wants to know, any issues with arginine triggering shingles, particularly in elders?
So it could. It's unusual that those type of things do happen. Again, if we've seen people, if they sort of power, shingles, of course, is very painful. You don't want to have people to go through that. But majority of the individuals, it's mostly mouth sores and that type of an issue with it. But again, if people power through the outbreak that they have, that they feel that arginine may cause, the relapse after that becomes very minimal. So it's a kind of an interesting phenomenon. But people have to. That's the benefit, though, of having nitrate-based therapeutic products as well, because if for some reason they just need to avoid the arginine-based products, well, we got another source, which is good because I ran into that a lot early on, and I didn't know what to tell people. It wasn't until this whole nitrate story really came to the fore, thanks to Dr. Brian and his group, that we have another alternative, at least for therapeutic nitric oxide boosting. And we're really going to be getting into that field. Of course, my background is with the arginine citrulline, and we've just seen amazing things with that. So I can't change that. I'm not going to turn away from the arginine citrulline, but this whole field of nitrate-based products does open up a new door. I think they both can be taken effectively. In some cases, an individual may want to steer more towards the amino acids, and others may want to steer more towards the nitrate base, depending on what their goals are or how they feel about their intake of certain nutrients. But it's pretty exciting that we can know about both of these pathways.
Yeah, I wanted to ask you about that. When is it appropriate to use both? Or like, you typically start as like the default setting for the arginine base, and then you go to the nitrites, or, I mean, how do you navigate that?
Yeah, so I think they work great concurrently. Both can be used. And the M3 as it was, because I didn't really understand dosing as much as I do now, we're really opening the door of the nitrate pathway with the M3 product. There's some beet powder in it, but we're looking more at these therapeutic amounts of nitrates that really create better outcomes. And so, maybe getting up to that 400 milligram dosage per serving. So we're going to be having products like that, but I think they both can be used. You'd still want to eat foods rich in nitrates along with your arginine-based products, and I think we're just going to see better outcomes. Even as Dr. Brian said in his publication, is that for some people, they don't seem to do very well with converting the nitrates to nitric oxide either. So you have both sides. Some may not do well with the arginine, some may not do with the nitrate. So you need to have, and some might do really well with both. And so, it's a lot to look forward to. More to come.
Interesting. Okay, Deirdre is asking about arginine plus taurine for people with arrhythmias.
I'm glad she brought that up, because I was going to mention that as a follow-up to the AFib question. So again, as amino acids, sometimes they don't do real well together. Taurine, 1,000 milligrams or more of taurine at a different time that you take the arginine and citrulline could be a great regimen. So taurine, fish oils, we know have benefits with AFib. Minerals like magnesium, high dose magnesium, and those type of things can be very useful for AFib as well. So taurine would be an excellent adjunct for someone with AFib.
But you said not at the same time, take them different.
Right. Mm-hmm. Take them again separate times.
Okay, great. Okay, let's see. Okay. Okay, another fun question. Louise is asking about, does taking arginine increase homocysteine levels?
So I have not, also that should be for reduction. It also helps. We've seen results with C-reactive protein levels. So the homocysteine and the inflammation and those type of markers, there's good data to show reduction in those type of things.
Great. Okay, any other last minute questions? Okay, here's one. Any data about boosting glutathione using these products?
There probably is. I've not looked at that, so I'll have to add that to my things to do my due diligence on.
Got homework, sir.
My homework, that's it. Yeah, very important. Glutathione is so key, and I'm sure there is some data, so I need to look at it.
Okay, we've got time for one more quickie if anybody's got a question. Okay, I think we've done it. Wonderful. Thank you so much, Jay, and thanks to Bionox for supporting this this webinar. And thank you all for joining us. I know there's a lot going on these days on all fronts, and we really appreciate your taking some time out to learn about this really, really important series of developments. So Jay, any last words you'd like to leave us with?
No, I have to tell you, Derek, it was great to be able to do this. We've been looking at different opportunities to be able to spread the word, and they're limited right now, right? With we had a big year planned to do some real exciting expos and to be able to share what we're doing. So I really appreciate the opportunity. What great questions, man! Those are excellent. It's nice to be with a group of like-minded individuals and looking out for the benefits of their patients. And I really appreciate the questions.
Terrific. So thanks everybody. Watch your email boxes. We'll be sending out a link for a replay. You'll be able to listen to this or watch this recording again. And also watch for the offer from Bionox for that 25% discount on the products. And with that, it's Eric Goldman here, Holistic Primary Care, and we'll say good night and bid you all well, and stay tuned for more webinars from Holistic Primary Care. Good night, everybody. Take care.
Have I done?
I think so.
Jay? Jay?
Hi.
Hi. I can hear you. I'm trying to, I think you can still be heard, and anyone who may still be up.
Oh.
I know this is strange. I can't seem to stop I can see your mouse. And I can hear, I think, your wife talking to you. So,
Really?
yeah.
I thought I was on mute.
No. She came in and said, "Are you over?" or something like that. So I would only suggest that's definitely, Can you go to the top of your screen and close the slideshow down? All the way to the top right-hand corner?
Can you hear me now?
Yep, I can still hear you.
So when I hit mute, you couldn't hear me, but okay. Let me just.
Do you see up there?
Exit out.
Great event, by the way.
Okay, so thank you. It was great. So I have the option to leave webinar, end webinar for all.
That's what you want to do.
End webinar for all?
Yes, you do.
All right, good night.
Good night.
Thank you.
You're welcome. I'll talk to you tomorrow.